resilient, stronger than power, soft as a flower. I know the hour, I am the times. It's the strength for me, it's the strength, it's the legacy.
Well, good evening. Good evening to our virtual friends out in Facebook and YouTube land. I'm Gwen McKinney, and I am here as the creator of Unerased Black Women Speak. Thrilled to be here and really excited about our topic and our guests. If you didn't know, Unerased Black Women Speak is your public engagement hub for, from, by, with Black women. We tell narrative, we shape content, and we help to lift up and shed light and love on our stories. Her stories, but our stories. So this evening, I just want to say, sometimes our topics are political, sometimes they're historical. Well, tonight it's very personal for me. And I'm hoping for you all too, that you'll get something personal out of this. As you know, every October, I call it the Pink Ribbon Month. There's lots of walks, lots of awareness about breast cancer. And the pink ribbons and the demands for breast cancer awareness are like at their height in October. But after the walks and events, the threats continue. And speaking of personal, it's actually going to be a joy to bring this conversation full circle because we want to talk about breast cancer, not awareness, vigilance. 365, 24/7, 12 months out the year, and in December. So we've got two very special guests. One is a TV reporter who's skilled in front of the camera, as well as a manager and senior producer behind the scenes. She hails from Baltimore and is on the air at Fox 45. Full disclosure, Brandi is also my goddaughter, and she's also what I call my daughter friend. Her story is really a very phenomenal one because Brandi, her mom was my college roommate who was diagnosed at the age of 37 with breast cancer. She waged a valiant fight. Brandi happens to be the mother of a 5-month-old and a 5-year-old, soon to be 5-year-old. But she's also the daughter of a phenomenal woman. And Brandi learned to be a caregiver. She literally, in many ways, she was 11 when her mother was diagnosed. And she was raised on breast cancer, understanding the challenges. And for her 40th birthday, or just before her 40th birthday, she did something very, very heroic, which I think is called a Preventive move. And she had a double mastectomy, learning that the genetic predisposition was a high risk. She didn't want to take the risk. And she's there for her two just precious little boys. Well, Brandi can talk for herself. I'm going to stop here and just say hi and let her say hi to you. Hi, Brandi.
Hi there, Aunt Gwen. Well, I'm sorry. Yes.
You tell me, Aunt Gwenny.
It's Aunt Gwenny. So thank you so much. I'm really honored to be here. I mean, I guess I've never had an introduction like that. You're right. I was certainly raised on breast cancer. So for me, it is as much a part of my life as anything else. And, I guess we'll get into it as we talk more about me and the Preventive thing and the mastectomy without being diagnosed with breast cancer, and how I kind of struggle with that, and kind of a little survivor's guilt, and kind of a little I don't survivor's guilt maybe is the best way to put it. But yeah, I mean, breast cancer, while I was not the patient, my mother was, and since I was in the 7th grade, I know breast cancer in and out. So just excited to be a part of this discussion. And I think it's important. There's so many young women like me who don't know what to do. They're afraid of what to do because their mothers were diagnosed, because their grandmothers were diagnosed. And so I do feel like sharing my story, which was a whole lot of surgeries leading up to this one, you'll find out the reasons why I did it, and why now my slogan is best boobs in the retirement home, because this shirt isn't really listen.
Go girl. Well, listen, hold some of that good stuff, because I want to introduce, this woman is a soaring survivor. And when she starts telling you the story, before I bring on my dear sister friend, Ricki Farley, I just want to say that she's a visionary and advocate, and she insists that Black breast cancer is a different disease. And Ricki ain't lying. She is not wrong. The stats are staggering. We're struck younger. We succumb quicker. We're diagnosed later. And we endure often the most virulent kinds of breast cancer. Compared to white women, Black women under 40 suffer 3 times higher as advanced early rates of breast cancer, with 39% higher rates of recurrence and 71% higher risks of death. Now, in the midst of the worst pandemic in our lifetimes, last June, Ricki Farley had the audacity to launch Touch Breast Cancer Alliance, to relaunch it, to build it, to push it out. And it's a collaboration with Black women, patients, survivors, researchers, advocacy organizations, pharmaceutical companies. And Ricki's mission is to push for a greater level of responsiveness to Black women and the unique circumstances that we find ourselves in. As I introduce her, Ricki is a kick-ass marketing maven who has created an organization that gives out pink shoes and who knows how to do a day-long satellite media tour. Oh, one last thing before I turn the mic over. This year, Ricki marks her 10th, Cancerversary?
Cancerversary.
Welcome, darling.
Thank you so much for having me. Thank you. I'm so glad to be here. It's so great to meet you, Brandi. And I call these my $500,000 boobs. Can you see them? So I'm right there with you, girl. Right? My treatment was all, all put together, right? But yeah, I'm I have 3 grandbabies. They're 4, 2, and 8 months. And they are my purpose. I know God left me here to do this work. They gave me 2 years to live. I'm on 10. And they're my purpose. I got to eradicate breast cancer before Belle gets boobs. So I got about 10 years. So
Isn't that wonderful? Isn't that wonderful? I want to just to both of you, and to those who are joining virtually, I want to start because I see some people sending in comments, and we love comments. I see folks from Philly, which is my hometown. I see folks from Baltimore. They're giving Brandi some love, from DC. I want to drop us a few lines. How many of you have been impacted? We got some survivors on here. We got some folks who are cheerleaders. Tell us who you are. And just drop us a little note, because we are here while you're virtual. You're there with us too. So I really, really we want to hear from you. So just let us shout it out. We can see it. And I want to really move this conversation along to ask both of you. We'll start with Brandi. What does vigilance, breast cancer vigilance, and the impact on the people you love, underscore what the meaning of vigilance means to you, Brandi? And then we'll have Ricki dive in on that.
I think for me, it is second, third, fourth, fifth, sixth opinions. That vigilance for me was, I didn't like what one doctor said. And I don't think I'm a hypochondriac. Some people may think that I am. But I think for me, I mean, my mother's story was that my stepfather was a doctor. She went to the best doctors in Baltimore and they missed it. And that's just what it is. She had, fibrocystic breast. She went to the doctor every few months, just like I did. They would do all the needle aspirations. They would do all the things. And a doctor told her it was like sticking their hand in a bag full of marbles. And they just chose the wrong marble until it was too big to be contained. And at that point, by the time they found it at 37, it had metastasized. And I mean, they said it had been there for years at that point. And again, she was on top of it. This was not a person who did not do self-breast exams. This was not a person who did not get mammograms. She did all of it and they missed it. And so from 37 until 55, she fought and fought and fought. And so I think one of her biggest fears for me was to get breast cancer. So I was screened at a young age, but I also started having issues at a young age. I mean, from the time I started developing these little A cups, they hurt. So she had me at doctors kind of looking into them. By the time I was 21, I had my first cyst removed and it was huge. Huge. He'd never seen anything so large in a woman so young, and he'd never seen anything that size that was not cancerous. And it was in the same spot on the same side that my mother's breast cancer was. So, fast forward to her genetic testing, which said she didn't have the BRCA1 and 2. And then 10 years later, when I got mine, they said I didn't have it either. But they told me that my negative was a false negative because based on what I had, constantly having the breast cyst issues that we were pulling out and the abnormal cells, and my mother having the same issue, they said that they didn't think that it was, they thought that it was a gene, but just a gene that they have not discovered yet. So vigilance for me was going to trusting the doctor that I had, getting a second opinion from the person that everybody said to go to. I went to a guy who told me I was too young for breast cancer and he didn't feel anything. And I happened to be in his office writing out thank you cards for my mother's funeral. So wrong answer. So I went to another person who I went to somebody, everybody said this was the person to talk to. My doctor was pushing for a mastectomy. This other person was not. And then I got in there and his receptionist called me and said, Brandi, this says that you're African American. And I said, I am.
Oh my God.
And she was like, oh, well, you never really can tell. But then that's just it, right? So what do you do when right?
Hey, let's take a minute there. That you unpacked a lot there, dear.
Sorry, I can take the whole time. I'm sorry.
But you unpacked a lot. I see Paula McKinney just said Brandi's dear mother was inspirational in her determination, resilience. I saw Stephanie Renee said her mother died when she was 11, and she will always remember that. Now let's go to Ricki. We're talking about false positives. What about triple negatives? When I heard that term, I didn't know what it meant. Ricki, in a very non-technical way, explain to us what the triple negative fix was that you were in.
So triple negative breast cancer. So there are subtypes of breast cancer. Okay, until you get diagnosed, you really don't understand them. But there are three main subtypes. One is based on, and it's really how it's like the portal that the treatment enters the cancer cell in your body. Okay, so the first one is based on estrogen, which all women have. The second one is based on progesterone, and the third one is based on an enzyme called HER2. And so basically, most breast cancers fall into one of those three categories. Triple negative breast cancer happens when you test positive, negative for those three things. And so triple negative is about overall 10 to 15% of breast cancers, but Black women get it at 3 times the rate. So about 30% of breast cancers in Black women are triple negative. Now, what's unique about triple negative is that we just identified 2 treatments really in the last year. 2 treatments have now come available. Only one for early stage triple negative, but triple negative has the highest mortality rate. It's the most aggressive breast cancer, and it's the only breast cancer subtype that does not have a drug to prevent recurrence. So you may have heard of taking something for 5 years, like tamoxifen or something. We don't have a drug. We don't have a drug. My drug is God and paddleboarding. So we can't prevent recurrence. We now do have 1 therapy, Keytruda, for early stage triple negative and 2 therapies for metastatic triple negative. But one requires a specific gene mutation that's about 20% of triple negative breast cancer. So not a lot of people can take it. And both of them are for 3rd line metastatic, meaning you have to have had 2 other treatments for metastatic breast cancer before you can take this one. So you're damn near dead, right? Wow. So even though we have 2 therapies and we're very blessed to have those therapies, they're still not doing the job because too many women are getting it. We're finding that younger Black women are getting triple negative in incredible numbers and also are getting it at advanced stages, to Brandi's awesome point that she had to advocate for herself, because so many doctors will dismiss a young woman and say, it's just a cyst, come back in 6 months. And guess what? They have metastatic triple negative breast cancer. So that happens so much more often than not. And so when you talked about vigilance, she did the vigilance. And I think vigilance for me also is knowing her story. You know, Brandi was in a great situation with her mom where they talked about it and her mom exposed her to it. But, you know, most Black families don't talk about health. We don't talk about health at the kitchen table. We don't talk about disease until somebody's dead, dying, or gone, or whatever, or severely ill. So knowing her story, knowing where you came from, getting that genetic testing, and also to Brandi's point, I think there are genes. I don't have any genetic mutations either. I think there are many genes for Black women that have not been identified yet, especially around triple negative, because we're not in the research. Mm-hmm. So right now, there's only 3% participation of Black women in clinical research. That's 0.
Well,
everybody's doing it wrong.
Ricki, and I know you're working on that. Why? And I know part of the answer. So it's not totally inquisitive. There's some rhetorical. So let me frame it another way. Why should we participate in clinical trials?
Because we're dying. Right now the drugs don't work for us. So for my triple negative, I did the standard of care chemo 10 years ago. It's 3 drugs that most breast cancers are treated with. I did a double mastectomy. I did 6 weeks of radiation. It didn't work. And those drugs, guess what, have never been tested on Black bodies. So I had to, my doctor said, okay, now you're metastatic, almost a year to the day after my diagnosis. And I went on 2 experimental drugs and they cured me. So I'm still here. And I know God left me here to do this work, but we don't know about the drugs because they've never been tested on Black bodies. If you think about most medicines overall are tested on 50-year-old white men. For most men, for across all diseases, right? But for breast cancer, we don't have Black women in the studies to know about our genetics that could be different from white women, to know about drugs that are definitely different from white women. So we're dying. And so until we get more Black women into the research, these trends are going to continue. And we're not.
So how do we do that? How do we get people in clinical trials?
When it's I'm not a scientist. I'm not a doctor. I'm a marketing person. I've spent most of my 35-year plus career, I'm old, trying to convince people to change their behavior through messaging. right? So right now, nothing is working. Nobody is doing it right. When you talk about 3%, that's zero. No pharma companies are doing it right. Nobody's doing it right. And we're now just starting to get the pharma companies to admit that. Yeah, we may be doing something wrong here because we're not getting the numbers, right? So it's really about how we talk about clinical trials to Black women. And the stuff, Henrietta Lacks and syphilis and all the history and all the mistrust, that's all there. And also the social determinants of health, like, how do I get to treatment? Is it gonna, how am I gonna miss a day of work? And, access to care, access to trials. And we just did a research study in the last 8 months or so, and we found that, and it confirms earlier data, that really about 30% of Black women will tell you they've never been approached by a doctor about a clinical trial. So the doctors aren't asking us to participate in trials. Our research actually shows that half of the women that we studied were never approached by their doctor. So they don't hear about them to begin with. And then their level of understanding of what a trial is and how it works is basically under 101, a 101.
Yeah.
Right?
Yeah.
It doesn't work. And so we heard things, and we heard a lot of this information from my breasties, my other breast cancer patients.
Breasties, everyone. That's besties and breasties.
Yeah, so my breasties. It's a club that you don't want to be in, but once you're in it, there's unconditional love and trust, right? So when a breastie tells you, "Oh, girl, don't do a clinical trial, you're going to get the sugar pill and die," you believe it. And so guess what? In cancer research, there is no sugar pill. There is no placebo. You get standard of care, which is a drug that currently is on the market, or possibly a new drug. And so just the basic understanding of how a trial works is not known to even people who have had breast cancer or in the breast cancer community. So we're finding that we're actually going to start a movement on January 11th. We're launching a movement to change the game on how we talk about clinical trials and educate, first and foremost, our breastie community, which is I call them the choir. We're going to educate the choir because they've got the connection and the trust of our audience, and then start to educate young women.
Well, you know what? I want you unerased and touch. Oh, that's interesting, isn't it?
Mm-hmm.
Touch unerased. Have to do a campaign together on that,
Yeah.
Ricki, because we're getting a lot of people buzzing in. And one question, I want to ask some questions. What kind of public policies are necessary? Selena
Yeah,
wants.
so hey, Selena, she's my girl.
Yeah, Selena, my girl too. We
Right.
both their girls. Hey there.
Selena. So we need some public policy. We need for the FDA to mandate participation. We need for the FDA to say, guess what, pharma company, we are not going to approve your drug unless you have participation in your clinical trial work commensurate with the population. So if the black people represent 13 to 14% of the population, guess what? They should be there in the clinical trial. And frankly, because we're getting breast cancer and have a higher mortality rate, it really should be double that number. So until that's mandated of pharma and they have to put their money where their mouth is, there's going to be issues. But the FDA could make that happen.
And I just saw a Dion from Baltimore said she just put it back out there on her timeline. Every Black woman in this country needs to hear this. I want to lean in to you two. And I'll start with you, Brandi, because both of you have some really amazing personal stories. Ricki, as a mom, when she had two daughters who were one getting ready to go to college, and when she got her diagnosis, she says, wait a minute, I don't have time right now to die. And she proceeded to do her thing. Brandi, at 11. So I want both of you to share a little bit, and maybe we'll start with you, Brandi, and then go to Ricki, and I'll shut up. Share with us some of the things that our audience, our sister friends who are out there need to know about what were the things that kept you going. And I know what kept your mom going, which was you. But tell us, both of you. So start with Brandi and then kick it to Ricki.
Things that kept me going during her journey, or
Yes, during
Okay.
your journey.
So yeah, I mean, I was 11. It's really all that I know. Breast cancer. I mean, it was just there. My friends all knew the rules. You can't come over here if you're not feeling well. We all get the flu shot every year. I think for us, it was just a way of life. One of my friends always says I'm nonchalant about certain things. And I told her, well, since I was 11, we had big things to worry about. I don't have time. My mother would always say, don't sweat the small stuff. We don't worry about little things, right? But I think that's because, yes, at such a young age, you are worried about cancer counts. And I did follow all of those things. I mean, we tore the highway up from Baltimore to Philadelphia and everywhere in between for treatment. I learned lessons that, again, if that means that you have to be inconvenienced a little bit, then we're going to travel for, the best care. We don't like the word no. We had a doctor who didn't like the word no. So I think that kept us going. Even when it was time for no, even when it was time to say goodbye, it was like, what, this is not happening because we don't say no. And then I think, honestly, for me, it was always, if it wasn't cancer, I wasn't so worried about it. Right. And so I had multiple surgeries and multiple cysts, and every 6 months we were alternating a mammogram or an MRI, and every 6 months they found something, which then meant it was really every 3 months, because they found something, then they want to test it again, then they want to call me back, then they want to do a needle aspiration, then they need more, then they want to do a surgery, and then after they take it out, then it's like, okay, it was it, and then 6 months later it's like, oh, guess what, it's back, oh, it's another one. It was just never ending. So for me, I think really having my son then made me say, I have to do this for him. So that's
was a double mastectomy. That's what made
right. They thought when I was pregnant with Bryson, back in 2016, it was time for one of my updated tests. I was seeing a doctor I was a little iffy on, who kept telling me come back every 6 months. And my gynecologist, who, is an older Black gentleman, was like, waiting for what? What are they waiting for? They're waiting for the other shoe to drop. And he was also my mother's doctor. So he's like, we know what happens here. Don't listen to her. Get rid of them. After you have this baby, get rid of them. They thought I was developing breast cancer because of all the changes they were seeing during the pregnancy. And once I had him, we then decided that, yes, I did not breastfeed. So that was a whole thing for me. And I know everywhere around you is breast is best. But you know what? For me, they wanted to not allow the milk to come in so that they could see what was going on. Because what we knew was, I had one test that didn't look great in February, and here it is October, and I'm very pregnant, and the test looked even worse. So when I had him in January, they were in there with ace bandages and ice packs, wrapping me to not allow breast milk to come in so that we could then get the test.
I remember that. And that's, Brandi's got people pinging in here from Baltimore talking about how inspirational Miss Sheila was. Moving to Ricki, you had two daughters who, and I think you made a joke about your divorce. I'll let you say that. But tell us what it was like in that journey to have that diagnosis, and then to make sure your girls, you could rally for and with them.
Yeah. And Brandi, I love your no. My motto is no is never the answer. It's always how, right? There is no, right? Don't say no, don't take no. So yeah, I was your typical, Black woman with the superhero cape, taking care of everybody. I was the breadwinner for my family. I was the rainmaker for my ad agency that I worked for. I had two daughters. Amanda worked in the Obama White House at the time, and Haley was a sophomore at Dartmouth. And so when I got this diagnosis, I was like, I don't really have time for this. Like, I'm too busy. Like, what are we going to do? And then my doctor called me back. She said, no, you have triple negative breast cancer, and it's no joke. And so I had to take it seriously, and I changed my whole life. And what I had to learn is that I was actually creating these dependencies and enabling these dependencies on me. And I think that stress
Talk about that.
With my breast cancer. I was enabling my husband of 30 years to not work. And I was enabling my business partner to also not work. I was doing everything for everybody. I was like the octopus with 20 arms doing everything for everybody. But I had to learn that, guess what? My peace is non-negotiable. and I had to get the stress out of my life. And I learned I had to get all of the cancers out of my life, not just the one in my body. And the lesson I learned was from my nurse navigator. And I don't know if I can say this on your show, but she said, you are so stressed out. You got to get the stress out of your life. And I was like, I'm not stressed. I don't believe in stress. Stress is for a cop out. Stress is for wimps. Who has time for stress? What am I going to not go to work, not be the kid? And how do I know I'm stressed? And she said, well, how many times a day do you either think or say the word asshole? And so in my head, I said it all day long. I probably never said it out loud, but that was the name I called both my husband of 30 years and my business partner of 10 years, probably with a lot of adjectives, one beginning with F, all day long, probably 100 times a day. So I realized that they were cancers that had to go. And so I changed.
So there were some internal things
Yeah.
that you had to deal with.
Yeah.
I think that, because we've got a lot of listeners, a lot of sisters out there who have either been directly impacted or, someone close to them have. What is the call to action? And this is because you're an advocate and you have an organization that is dedicated to an alliance around breast cancer. And you said you're going to find a cure. What's your call to action, Ricki?
Check your breasts that you love. I know you have a pair. Know her story. Know your body. Brandi knew her body so she could fight for herself. And she knew what her mother, she knew her story with her mom. So know that about that. Have those conversations with your matriarch, with your mamas, your aunties, your girlfriends, your kids, your daughters, your sons, because, Matthew Knowles could pass breast cancer on to Beyonce. We don't know, but he has the gene, right? So know her story, know your body, and know that it's okay to fire a doctor. Know that it's okay to say, I'm not going to accept this. I'm going to fight for myself, and I'm going to get the best care. But the call to action is just know your body and check yourself. Check yourself regularly so that if something is abnormal, you can fight for yourself to get it taken care of. And talk about it. We have an Hbcu internship program. So we've had 15 amazing little girls. I shouldn't call them little girls because they're brilliant young women. They're all pre-med or pre-health students. And they do a social media campaign about breast cancer on their Instagram. And we asked them to do a video with your mom and do a video with your best friend and talk about breast health. And in every circumstance with the 15 interns, that was the first conversation they had with their moms and their girlfriends about breast health. So not only are we educating their peers, or we're actually helping them be that sort of stimulant into the family to talk about and bring these conversations to the kitchen table and talk, hey, grandma, what's her story? Hey, mama, did you get a mammogram? And so we have to put these, on the kitchen table and make these conversations part of our daily life. You talk about going to the dentist. You talk about going, to get a checkup every now and then. You talk about going to the gynae. You ask your mama for birth control. So breast health should be part of those conversations. It shouldn't be something that you hide. It should be something that's top of mind and ever present, because guess what? Black women are dying at a 42% higher rate. You saw the statistics. And Black women under 35 are getting breast cancer at twice the rate of white women and dying at 3 times the rate. It's really the most fatal disease for Black women relative to white women right now. And it's a crisis that has to be addressed.
So now let me just say this to the audience. You're going to hear more. Ricki and a wonderful cast of women warriors are going to be part of our podcast, Unerased Black Women Speak. You can find it on Apple or Spotify, wherever you get your podcasts. That's going to be in January. Just want to do that public service announcement. If you have not yet subscribed to our podcast, you can. And you can also learn a little bit about Ricki. We did a profile on her that's on our homepage. It's called No Time to Die. And how do you get to that? It's Unerased BWS for Black Women Speak.com. Unerased BWS.com. Okay, I'm going to ask Brandi about a call to action. What is your call to action?
So I do think my call to action would be again for young women, because so now all of my friends, like, they all hit their 40-year last year. I'm a little younger than
Old ladies.
so but I think still, for whatever reason, whether they are afraid to do it or just don't think it's necessary, or are actually nervous because their grandmother was diagnosed, for whatever the reason, I think, yes, certainly mammograms are important, but it's bigger than that. It's all of the different things that go along with your health that I think we need to be talking to our doctors about.
Yeah.
And again, right, because it's not just mammogram. Again, the mammogram didn't find it for my mother. For a lot of people, it does, but for a lot of people, it doesn't. And there are other things. And then again, just not letting them ignore you. I mean, I had doctor after doctor who told me wait 6 months, who, again, I went to the specialist. I won't say at what hospital, but everybody said he was the one to go to. And my gynecologist said, Brandi, you told me that he told you not to do the mastectomy. I said, that is what he said. He said, that's not what he told me. He said, in his note to me, it says you are a 37-year-old Caucasian woman. And this is a different doctor than the other one.
So the one thought you were white, and now this one is identifying you as Caucasian.
Same thing. And he said, and I chuckled, but it's not funny, because he said he is wildly underestimating your risk. So I need you to listen to me and stick with the doctor that knows you, your history, and your ethnicity, because that plays a part. And so, I think just
so important.
Right. For younger women, that would be really my call to action, is to pay attention to it. A lot of my friends have fibroids and other issues that could still have those underlying, all of those genes that we don't really know about.
Absolutely. And I think that type A gene that Ricki is talking about, that I wouldn't know anything about, Ricki, but that actually generates the kinds of toxins in your body that can create the cancer cells. And I think that you're pointing something out. Audience, I'm going to ask you all to drop us in the comment box. I'm going to ask 2 questions. You choose which one. The first one is, what preventive measures can you put in place to guard against breast cancer? That's the question. Breast cancer and all cancers. What preventive measure can you put in place? 1. 2, how can we bring joy to someone who may be struggling with the cancer diagnosis? Let us hear. Oh, I heard someone say, hey, to just believe in yourself. Come on, folks. Drop us a line and tell us, because I think those are really important questions. Back to Ricki. What kinds of things do you recommend that people do once they've had the diagnosis?
So get a really good doctor. And, this week, one of my little brain farts, I'm always having these marketing brain farts. I try to think of a better definition for the word health equity, because health equity, diversity, inclusion, what does that mean, right? So I was on a call with a pharma company that I work with, and they said, okay, well, what do you think about health equity? And I said, you know what? Health equity is unconditional access. What does that mean? That means that your doctor treats you like they would treats you the way they would treat their daughter or their mama or their auntie or their cousin. Treats you like family. And my co-host on my show, The Doctor Is In, is Dr. Monique Gary. And the first thing she says to her patient, to a new patient, is, I'm going to treat you like family. So a lot of the issues that Brandi had was because those doctors had implicit bias. Even the one that assumed she was white had implicit bias. They weren't treating her how they would treat their family. And until we get to the place where there's unconditional access by the medical community, we're going to have all kinds of issues. Bias is not going to go away, right? So that's why we have to advocate for ourselves. and ask for the right care, ask for clinical trials, ask for, that extra mammogram, ask for that other report, or ask for that other treatment. So it really, so to me, when you get diagnosed, go find a doctor that's going to give you unconditional access and unconditional love and treat you like family. And if you don't feel that from the doctor, then go to another doctor, but get the best care that you can. Get the best care that you can. And you know what? Fight like a girl. You got to fight like a girl. You got to do the work. And, I really did have to relinquish my faith. I remember waking up one day after my first chemo. On my first chemo, I got C. diff, which is a horrible bacterial, infection, which landed me in the hospital. And, when they tell you you're going to get nauseous, I didn't know what chemo was versus a bacterial infection. So, and I remember calling one of my best friends and saying, I don't know what to pray for. And she's like, pray for healing. Damn it. What's wrong with you? But I couldn't pray for healing in my spirit. I had to pray for God's will. I had to pray, okay, God, we're about to jump off a cliff. I don't know what's going to happen. You know what I'm up against. I got to get this kid through college. I want to be a grandmother someday. I don't want to die now. So I had to relinquish my faith, but I also had to know that faith without works is dead. So I had to do the work. I had to get the surgery. I had to do the chemo and do the work, but I had to fight like a girl with faith. And so that's my advice.
Yeah, that's pretty tough. What do you say to that, Brandi?
So here's where like the survivor guilt comes in, because I don't know what to say. You know what? I feel like I'm not always out there with the mastectomy in my story, because I feel like it's almost a slap in the face to the women who have fought breast cancer, who, they're dealing with their own mortality. And here I am just like upset because my scars didn't heal right,
I know, Brandi.
All right, let Ricki take that survivor guilt.
Brandi, I have survivor guilt too, honey. And you know what? Because I have so many friends who have died, and I'm still here, and I should have died. My doctor told me I was going to die. So I have survivor guilt too, but you had a choice. I've been in situations with previvors who are whining about, I had to get the surgery. I can't, I had to do whatever. And they whine, right? And I'm like, you had a choice. You had a choice. If I had a choice, oh my gosh, I would have taken that choice. I get very frustrated when I hear women with stories that don't make the right choice and say, oh, I don't want to get rid of my breast. And even down to breast cancer patients who, so our recurrence rate for Black women is 39%. So, I'm not a doctor, but I want people to get mastectomies, get a double mastectomy, because guess what? That cancer can come back if you have breast tissue. Why risk it? And so I get mad then, but you have to make the right choices. You have to choose life, and you chose life. So don't feel guilty about that. And I choose life every day in the decisions that I make, but I still have survivor guilt about so many of my friends who have a recurrence because guess what? They got a lumpectomy or have a recurrence because of whatever, and when you ask the question, Gwen, you really can't prevent breast cancer, but you can early detect it. And that's what we have to work towards. I mean, clearly you want to have a healthy lifestyle, but it's that early detection that's going to save your life when, because.
And so that's one of the things that, like, when they explain to me, whatever, they monitor you 10 years from the time that your mom had her first breast cancer. And, my mom was 37, but they felt like based on the size that it had been there all these years. So they started looking. So that would have been 32 for her. So by 22, I was getting mammograms. Yeah. So, in all of that, then they say you have a 20 in that, you have whatever the percentage is when they put all your stuff into the computer, and they put all kinds of stuff in that little predictor for me, right? It was as low as 30% and as high as 80%. So they told me, well, we'll take the average. Oh, well, that's still 50.
No, it should be the 80. It should be the highest number.
Exactly. Right. So fine. So I decided to do it, but I was scared. Like, I'm not gonna lie, I was scared. It took me
a
couple years. And I think part of it was that I did feel like I had a choice. And I felt like it on one hand, I'm like, are you stupid? Just do it. On the other hand, it was like, am I overreacting? Because remember, I walked away from this doctor who told me not to, and this doctor who told me not to, and this doctor who told me wait 6 months. And because the 6-month lady told me she was concerned about nipple deformity. She didn't understand why my doctor kept cutting me, because they kept going in, taking out more, removing another duct, removing another cyst. And I was like, you're concerned about what? Because I'm talking about my life.
Right.
So
Right.
that was my last day seeing her. But, so now am I making the right decision? Because I have this doctor that knew my mom and has known me since I was a teenager. And this other guy who went to medical school with my mother's oncologist in Philly. So he's as close to her oncologist as I was going to get. And it's just these two out on a limb and everybody else saying, don't do it. And I was scared, but we did it. So,
You did it. And it sucked. But you know what? It wasn't a pleasant experience, but trust me, it doesn't suck as much as cancer. So
right.
And you know what? Both of you are sharing experiences, and the comments are coming in. I'm trying to read them, and I can't even listening to you all and reading the comments. It's just, I'm overwhelmed. The thank yous that you all are getting for telling this story, the hope that I'm hearing sisters say, please remember vigilance regarding breast cancer is important. They're also saying our health across the board, even including heart disease and other things, just us taking care of ourselves. I want to, as we get closer to signing off, I want to just shift for a minute, because one of the things that Unerased Black Women Speak is really going to focus on in 2022 is joy. Black joy. Black women's joy. What lifts us up? What makes us smile? What gives us the resilience? Resilience doesn't come just from having a tough struggle. It comes from being able to laugh, to fight another day. So for both of you and for our audience, drop in some things. So what is the joy you have been able to eke out? I do want to just share this with you, Brandi, and because this is very personal, and my heart is kind of heavy because Brandi knows I was there with her and her mom when her mom took her final breaths. So I don't want to get emotional. But one thing that I loved, when Sheila lost all that beautiful mane of hair, and she was bald, one of the things we had so much fun doing is, remember she used to have those stick-on tattoos? And it was just so fun. She had hearts and kisses and flowers and glitters. She had the most beautiful glittering bald head you could imagine. And that was joy. It was a wonderful sense of, you know what? Cancer may have taken my hair, but it ain't going to take my heart. So for each of you and for our audience, what are some elements of joy that we can pull from this?
Go ahead, Brandi.
No, I don't know. I was going to let you go first.
I'll go first. So, actually, when I was bald, we have a really good friend who's a photographer, and she did a photo shoot of me and my girl.
I love that photo.
Yeah, you saw that photo. Yeah. So we made fun out of it. We shaved my head and then we did a photo shoot. But you know what? My grandbabies bring me joy. And that's why I work every day for them. I'm the nanny on Mondays and we just have a blast, They FaceTime me at 7:00 in the morning and, quite often. And we talk about our day, but they bring me joy. And that's why I work so hard. I work for them. And, they give me my peace. But I also say, your peace is non-negotiable. Find peace in your life. I dance a lot. I pretty much dance every day.
Yeah, tell us about the pink shoes.
And I have a terrible shoe fetish. So I only wear pink shoes in October every day. And I may have a few more pink shoes than 31 days, but that's okay, right? And pink cowboy boots. I have my pink warrior boots, but we were able to do a really cool promotion this year with Sarah Flint shoes. And Sarah actually made a pink shoe for Touch. And gave us,
Can people get them? Can people get them?
Yeah, we can get them. Yeah, if you go to
Sarah, tell us how we can get the pink shoes.
SarahFlint.com. And all of her shoes have it in.
So they can post it. Ricki?
Yes, Sarah, it's Sarah, S8 with an H, Sarah with an H, Blint.com. And they have a store in DC, but they really are online. And she's a 31-year-old shoemaker. The shoes are fabulous. So every shoe that she makes has a name. So our shoe is the Natalie, and it's this very cool, like pink, kind of like crocodile.
Yes, I did see it.
It's a hot shoe. But Sarah's been very supportive.
Do you have a pair of them? Of course you do.
Oh yeah, I had the first pair off the press. So even before she did. So I had my pink shoes. But you just have to live your best life every day. I live my best life every day with my grandkids. I live at the beach. I really quit my life and started a new one. I sold my big house in suburbs in Atlanta and moved to my little 1-bedroom condo on the beach. I go paddleboarding as much as I can, and I try to live my best life, and everybody should, and you shouldn't wait till you're sick to know that your peace is non-negotiable.
Yes.
Now.
Joy, Brandi, what joy? What joy are you eking out of it? I know two things of joy.
Yeah. So I do. I think what you said, and also, like I was saying, us learning not to sweat the small stuff, and to look forward to those good moments. My mother lived every day was a holiday. Anything that she could celebrate, she did. Every day. Shamrock earrings. We're not the first bit Irish, but you couldn't tell her that she wasn't getting her corned beef and cabbage or everything. She celebrated it all. I mean, she would put on these fantastic outfits, and I would be like, "Where are you going?" And she would say, "Giant, to get my prescription." Like it was like, how dare you? So, So yes, I think that I do try to find some reason, as sad as I am, and my mother not being here is such as part of my life as breathing is every day. Anybody can tell you that, I am so affected by her not being here. But I do find joy, whether it is sitting down to watch Home Alone I've watched Home Alone every night this week.
Right. I believe it. Yeah. I've watched Cinderella probably 30 times.
That's right.
I
want Billy Porter's fairy godmother gold pants. Right.
So, it is the small things. I definitely, I have a super supportive husband who makes sure that we do date night, that he squeezes in, whatever time, for me. And listen, I find a little bit of joy in alcohol. My name's not Brandi for nothing. So
we do know that. Well, I will say this, and I'm going to say this to the audience who I love. Please, folks, stay tuned for our Black Joy. We're going to have so much. While we certainly understand that there are struggles, and we're not trying to evade or deny that these are some dark days. But if we don't have light and levity, we have no reason to fight to beat back the dark days. So think about it. We're going to have some stand-up comics. We're going to have some cooking demonstrations, some travel folks. And like you said, just some good belly laughs. So I'd like to close now by just thanking both of you. I am so honored that you two brought your full selves to this conversation. We're going to end with, also, Ricki is a prime timer. She is one of our prime time phenomenal women. And we're going to show you a little clip in case you know a prime timer that you want to recommend. And then we're going to end with a little joy. Our Unerased theme song, which was commissioned and written by one of our colleagues, Carolyn Malachi. Check out the video and the music, get a little joy. So we're signing off now, but I want to thank everyone for coming, and especially again to Brandi and to Ricki.
Resty love.
Thanks, everyone.
Black women are trailblazers who overperform in every field. But Black women, especially those over 55, are mostly missing from influential primetime cable news. Primetime 55 Plus showcases the accomplishments of Black women 55 and older. Join us. Go to primetime55.com, click on 55 Plus directory, and apply.
into my blues, I stand before you, resilient, stronger than power, soft as a flower. I know the hour, I am the times. It's the strength for me, it's the strength, it's the legacy, it's the faith, it's the history unerased of a sisterhood, of a race. It's the strength for me, it's the strength, it's the legacy, it's the faith, it's the history unerased of a sisterhood, of a race. Appreciation, I need to know you know who I am and what I've achieved. Honor my journey, you could learn from me. Where there's a ruse, I speak the truth. I'm looking at you with respect and appreciation. I want for you the very best in all situations. When we get together, I feel so alive. No lie. Oh, we don't put up with neglect. Yeah, we are done risking our necks. We deserve all the love that we desire. That's by design. It is the strength for me. It's the strength. It's the legacy. It's the faith. It's the history unerased of a sisterhood, of a race. It's the strength for me. It's the strength. It's the legacy. It's the faith. It's the history unerased of a sisterhood, of a race. It's the strength for me. It's the strength. It's the legacy. It's the faith. It's the